He attended the medical school at Indiana University, completed surgical residency at St. Francis Medical, University of Illinois, and completed a vascular surgery fellowship at University of Iowa. He has more than 16 years of vascular and endovascular surgery and cosmetic vein care experience, and is a current member of the medical staff at St. Cloud Regional Medical Center.
Thank you very much for letting me come and talk a little bit. I don't know, vascular surgery sounds kind of complicated, but it's pretty simple. It has to do with anything that has blood inside. So it's usually the arteries and the veins. So the arteries usually are the ones that take the blood away from the heart towards the head or towards the feet, and the veins are the ones that bring the blood back to the heart. Anything that happens to that, either because of closure or insufficiency, that means not enough blood, then it means you're going to have something going on. If it's arterial circulation, then it means that if we're going towards the head, if there is any problem with the carotid arteries, you can have a stroke or symptoms of a stroke that can be as simple as having a black shade of one eye and losing eyesight for a little bit, which is a symptom of a stroke, or having weakness in the arm or leg and unable to talk, or have a problem with your face, slurred speech, anything like that is a stroke symptom. And it's what we always hear everybody saying, that if you have that, you have to call 911 because it's like having a heart attack of the brain. And it's better to be evaluated quickly and fast so that it can be treated. If we go from the arterial circulation towards the lower extremities, upper and lower extremities, is basically anything that is causing any type of blockage, you will have problems. For example, if there is a blockage of an artery towards the legs, you may have pain while you walk. You may have pain in the foot while you sleep. You may have some wounds in the legs that do not heal. Or you may have any type of insufficiency, any discoloration, bluish discoloration of the toes or dark. Then there is a problem with the arterial circulation, and it's probably better to have it evaluated before it becomes a problem. On the other hand, if there is a problem with the veins, that means there is not enough blood going back to the heart. Then the legs will become bluish or purplish, or you have varicose veins due to the fact that the valves are not working very well. And the valves are, usually we find them in the legs so that they will help with the blood flow back to the heart by avoiding any pressure from the gravity. And if you have problems with the valves, you're going to have difficulty with swelling or blood clots or varicose veins, and all those things kind of put together is our circulation. And we can sit here and talk for 2 years about circulation and vascular surgery, but I don't want to say too much. If there are any questions, I'll be glad to answer them. And I'm originally from Greece, so that's why I have an accent. But I have a green card, so don't worry. Yes.
So I know that there are kind of risk factors when it comes to heart attacks and stuff like that. But in terms of general health and well-being, what are some things that could contribute to your likelihood of having a stroke?
Yes, it's exactly the same. Really? If you abuse your body, you will pay for it. And what we talked about, what our friend talked about it before, about opioid, is the same thing. If you eat too much, something will happen to you. If you get diabetes, you get high blood pressure, you gain weight, all these things, they add up. So if you have diabetes, high blood pressure, if you smoke, If you don't walk around and don't do anything and sit around like I do and watch TV all day, then you will pay for it. If you don't go and get your physical every now and then, just to make sure that you're not having any problems, then there will be some issues. But basically, yes. Unfortunately, the same thing with the heart attacks is the same thing with the stroke. It basically is the same etiology behind it. Whenever there is a blockage in the heart, in the arteries of the heart, you're going to have a heart attack. Blockage in the arteries that go to your brain, you're going to have basically a stroke. If you have blockage in the legs, in the arteries, you're going to have, unfortunately, could be end up with gangrene and lose the leg, amputation.
Wow.
I didn't scare you, did I?
No.
Okay.
We'll take one more question if anyone has another.
I know, it's too scary stuff. It's better not to go to the doctors. That's the best thing not to. Thank you very much. Yeah, okay, go ahead.
I was just going to ask you, maybe it's obvious it's exercise, but what would be your top tip for having the best vascular and endovascular health?
The best tip to have vascular and endovascular health is the same for the cardiac. Basically, the circulation of the body is the one that is the most important because it feeds everything. From your hair to your nails to your feet to your skin, it's everything. So what does that mean? It means you have to eat well, you have to exercise as long as you're okay and health-wise you can exercise, and treat your body well. It's pretty simple, but unfortunately we forget that that's what you're supposed to do. Is if you take care of yourself, your body will take care of you. All right? Thank you.
Thank you, Doctor.
Thanks.